Okay, so a lot of times when people come into my office, they ask me, they'll say, well, I've got these tests from my medical doctor, and they'll show me something like a beginning thyroid panel, or maybe they have a lipid panel which targets their cholesterol, triglycerides, stuff like that. Okay, what I wanted to tell you is what is actually needed to assess the whole function of the body. So when you get like your regular test from a medical doctor, a lot of times, I'm going to give you an analogy. If you brought your car in to get checked out at the automotive center, okay, and they said, your tires are fine. Well, you'd say, well, how's the engine doing? Okay, how's the steering doing? How's the brake system doing? There's all different parts of your car. There's all different parts of your body, okay? And they all need to be checked. They all work in conjunction. We are not just a thyroid. We are not just blood sugar, pancreas. We are not just a digestive system. Everything is integrated together, okay? And so you need to actually do a bunch of lab tests at once to be able to assess things properly. I'll give you an example. Like, let's say one of the most famous things that people come in with, they'll say, oh, I have my thyroid test here. They look fine. And I'll say, all right, well, let me take a look. And they'll only have a thyroid test. And I'll say, well, how do you feel? And they'll be like, I feel like garbage. And I'll be like, well, and they'll say, well, what's the problem? And I'll be like, well, they only ran a thyroid test. They didn't run something to assess the immune system, vitamin mineral deficiencies, blood sugar disorders. They didn't show one for inflammation. All these things can cause fatigue, okay? Symptoms, like even though one of the primary symptoms of thyroid stress is going to be fatigue, there's many things that can cause this. So we need to know what actually needs to be run in order to assess the whole person, not just one organ system, okay? And so what things do we need? First of all, and these are all standard blood tests, and we're going to get to urinalysis in a second here. They're all standard. It's just that most doctors don't run all of them. I think one of the reasons why they don't is medical doctors are looking for like one specific cause instead of looking to check the whole individual. Also, I think there's probably a lot of pushback from hospital and medical administrators and also insurance companies. We have none of that pushback because we are not allied with any of them. Okay, but the first thing that you want to look at is what's called a comprehensive metabolic panel, and this will show you everything from your chloride, your carbon dioxide, your blood sugar, your liver enzymes, your kidney enzymes, and much, much more. And so that's really needed. Okay, the next thing is what's called a complete blood count with differential and platelet count, CBC with diff and platelet. What this shows is what's going on with your red blood cells. That tells about anemia. It can tell about chronic infection, acute infection. It can tell about dehydration. It can show about iron deficiencies, vitamin mineral deficiencies. That's a complete blood count. Okay. The next thing that we need is what's called a complete iron profile with ferritin. Why do you need this? You hardly ever see this ordered. The reason why is when you're looking at the complete blood count, like a lot of people, there's 1/3 of the world's population has an iron deficiency anemia, okay? The thing is that there's other reasons why you have anemia. And you need to know one of those causes, the primary cause is going to be iron deficiency. But there are other things that will cause that. You can get anemic from a B9 deficiency, a B12 deficiency, a B6 deficiency, a B1 deficiency. You can have a copper deficiency. The other thing that you can get is if you have like a chronic problem, chronic inflammation, a chronic immune system problem, they can all cause anemia. And so you need to differentiate causes of problems in the complete blood count, okay, with iron, okay? The problem is that people will say, well, I'll just take iron, if I'm anemic. That is a very bad move, unless you have had it diagnosed by a doctor. And I'll tell you why. Because bugs, things that, infections, one of the primary things they live on is iron, okay? One of the primary reasons why people are anemic is because they have a chronic infection. Okay, you see there where this is going. If you have anemia because you have an infection, and that infection is living on iron, and you feed that person more iron, that infection will get worse. I had a patient one time, and she said she was feeling tired and she was anemic, so she's like, well, I'm going to go take iron. And her iron levels went sky high, okay? She did not get better. She got worse. You do not want to do that. You have to have that properly assessed by either a medical doctor or functional medicine doctor, okay? Make sure that if you're looking at anemia especially, you're always looking at the complete blood count plus the complete iron profile. By the way, I'm going to do lots of videos on all these. I recommend watching all of them so you know what the heck is happening with your blood chemistry. An extended thyroid panel. A lot of times people will come in and they'll say, well, I had my thyroid checked, and they'll have what's called TSH. TSH is the thing, is kind of like the most basic of thyroid panels, and it'll show whether or not your pituitary is producing what's called thyroid stimulating hormone, TSH. It'll show whether or not it's stimulating the thyroid. It will not show, though, whether you have adequate thyroid response, meaning do you have enough thyroid hormone, and is that hormone actually being converted from the inactive form T4 into the active form T3, and whether it's utilized by your tissues. That's why we use an extended thyroid panel. Another thing that never ceases to amaze me is that vitamin D levels sometimes aren't checked. Now, since we've had the pandemic, since 2019, 2020, 2021, you'll see a lot of doctors checking for vitamin D. They should have been doing this for years. But that is a cheap, easy way to give you information about your immune system, your hormonal function, your bones, and that is absolutely needed. By the way, more doesn't mean better with vitamin D. Better means better. There's an optimum range, and we're going to do that in a separate video. But to give you a spoiler alert, it's usually 35 to 60. Okay, just remember that. Other inflammatory markers, including CRP, fibrinogen, homocysteine, LDH, and uric acid. A lot of people, one of the buzzwords in the alternative medical community, and even the medical community right now, is inflammation. People know they have inflammation, but they don't know how to quantify it. You can quantify it with your blood test, and it'll show up in these primary things. CRP, that's cardioactive protein, fibrinogen, homocysteine, LDH, lactose dehydrogenase, and uric acid. Those things, when you check those all out, there's other ones too. There's sedimentation rate and some other ones too, but those are the main ones that you use. But you can assess what your inflammatory level is, and after treatment, what it's come down to, or conversely, if it's getting worse. That's really important. Also, something that, like I said, never ceases to amaze me. People say, well, my blood sugar is fine. They're usually referring to what's called a fasting blood sugar. Fasting blood sugar is the last thing to go off the charts when you have a blood sugar problem. The first thing is actually a fasting insulin. I have never seen a medical doctor order a fasting insulin, and they should. If you multiply, we have another video on this, okay, about blood sugar. If you multiply the fasting blood sugar times the fasting insulin, divided by 405, you get a number. If that number is less than 3, actually, if it's less than 2, you're doing pretty well. If it's over 3, you've got severe insulin resistance. You've got at least the beginning of blood sugar problems, okay? It needs to be assessed for. If your doctor is only testing for fasting blood sugar, you need at least the fasting insulin. Also, a lot of times, doctors don't check A1C. A1C, what's called hemoglobin A1C, that's a measure of how much sugar is attached to the hemoglobin molecules over a course of time. So it gives roughly a 3 to 4 month window into what your blood sugar stability is. If you see a high A1C, it means you've had high blood sugar over that last 3 or 4 months. If you see a low one, you probably had low blood sugar over the last 3 or 4 months. So it's used, fasting blood sugar just tells you what that blood sugar is at that point. Fasting insulin tells you how hard your body has to work to keep that blood sugar down. By the way, if you look in the textbooks, Mosby's is the one for physiology that we use in medicine, chiropractic, any kind of medical field. We use Mosby's. It actually says in there that fasting insulin will precede more severe blood sugar problems by years, okay? And you can watch as you change your diet, exercise, stress reduction, how that comes down. We do it all the time. But fasting insulin will tell you basically how hard your body has to work to keep that blood sugar down.
Hey, Dr. Sean, I can cut my voice out, but can you just point out that the fasting glucose is included in the CMP, just so people know?
Okay. And by the way, okay, just as Jen was pointing out, thank you. You don't have to cut that out, don't worry. Okay. We're just going to roll these. The fasting glucose, by the way, is in the CMP, the Comprehensive Metabolic Panel or Metabolic Profile. So it's in there. Okay. What else do we need? Another thing that we need is folic acid and B12. Why do you need these? Because they're important. There are markers in under inflammation. The homocysteine will give you an indication of your folic acid and B12, but it will not show you exactly. We always run those, and I will tell you why. If you have low folic acid, it really slows down your detoxification. You hear about detoxification all the time. If you don't have enough folic acid or B12, you will not detoxify properly. And I have seen people be extremely low in this. And all it takes is to either increase your folic acid or folate intake. You can take a supplement for it, and it responds beautifully in your blood tests, and the person feels better. The other thing is B12. B12 is rampantly deficient, especially in kids, elderly, people with blood sugar problems, people with pain, people with anemia, all types of things. It is rampant. It is a big, big problem. It's also incredibly easy to fix. The problem is, if you're low in B12, one of the primary things is that if you're below an optimum level, and optimum levels are between 450 and 550. The state at which you're actually deficient, I think, is like 276 or something like that. But if you're less than 550, you can have B12 deficiency symptoms like pain. You can have increased homocysteine, which was on the previous page, causing inflammation. You can have all sorts of problems, okay? The problem is that if you let it go too long and you have nerve damage from this, and I've had patients with this, and it's very common, it's irreversible. In fact, one of the things that a B12 deficiency will mimic is Alzheimer's. And I have somebody in my family with Alzheimer's, and they were diagnosed with Alzheimer's, and they were being treated for Alzheimer's for a couple of years. And then the doctors checked, and guess what? She actually had a B12 deficiency on top of that. They gave her a B12 shot, and they said, you should be fine. I said, no, you're going to take B12 from now on. She's elderly. But the thing is that she already had Alzheimer's. Remember I said the brain changes, the neurological damage is irreversible. And so it's easy to prevent. By the way, you know what the side effect is of taking too much folic acid or B12? Unless you take tons of folic acid, you can have a little bit of too much detox. But if you take like way too much B12, you know what the deficiency or no, the problem is? Nothing. Nothing happens. You pee it out. No big deal. And it's dirt cheap. I mean, if you take one good B12 per day, you know, you've got it covered most likely. We track people's tests downstairs all the time. We're upstairs doing this video. Okay. The other thing is we do a routine analysis. It is shocking how many people come into my office with some kind of urinary tract infection, immune challenge, something like that. They can have dysbiosis, or they can actually have an immune system problem. Okay. Dysbiosis means that there's like a balance of good guys and bad guys in your digestive tract, all over your body, really. Digestive tract, urinary tract, even on your skin. Okay, and sometimes the bad guys start to outnumber the good guys. That's called dysbiosis. But routine urinalysis will find this out. Also, I'm also a chiropractor. 1 to 3, 1 out of 4 people have a problem in their urinary tract with no symptoms. A lot of times the primary symptom is back pain. And I will tell you, being a chiropractor, I'm going to speak to the other chiropractors out there, you should be testing everybody for this. Because if you're treating people for back pain and they have an infection, you're not doing your job. And it makes us look bad. I mean, you know, we're always fighting uphill, you know, being alternative care practitioners, being a chiropractor, and then we're treating back pain by, but not actually fixing the infection. Bad move. So anyway, that's the other thing that we do, is routine urinalysis, or we order out for that. We don't do it in the office usually. We can do it in the office. Okay. Did I answer the question? Okay. All right. So those are the tests that are needed for a proper evaluation.